Welcome back. Now let's turn our attention to the COVID-19 pandemic proper. It's no longer news that Nigeria is currently battling a second wave of the virus. Sadly, most Nigerians are not adhering to safety protocols put in place to keep the spread of the virus now at bay. For instance, we saw how many Nigerians disregarded COVID-19 rules in markets, airports, and other public places. In fact, videos emerged of a crowded party in Ibadan, the Oyo State capital. Now, following all of this, the federal government has raised concerns that the month of January might be severe. Take a listen now to the chairman of the Presidential Task Force on COVID-19 speak on the consequences of these large gatherings and how it can reverse the gains the country has previously recorded.
I saw one event center with over 500 people congregating. I didn't see a single mass. And they were shocked. That's a super event spreader. The effect of what we have created this December, when we get into January, the figures will be higher in terms of infections. If we are recording 1,000 plus, be ready for 2,000 plus when we come into January. Be ready for more fatalities when we come into January, because that's the truth about it.
Well, let's just hope that doesn't happen, because that's quite a grim picture there. Also, amid reports of a new strain of COVID-19 emerging in the country, the Director General of the Nigeria Center for Disease Control, NCDC, Dr. Chikwe Ihekwazu, says investigation is ongoing. However, this discovery could have added to the level of misinformation about the pandemic. Now, take a listen to Dr. Ihekwazu speak more on the new variant and the challenges posed by fake news.
There's a new variant circulating in the UK, but like we've said severally, there are new variants of viruses appearing all the time. The question is whether this new variant is associated with any increase in transmission or severity. We don't know that yet. We suspect that this variant is already in Nigeria. It would be surprising if it is not. But we simply don't know yet. So what we are doing are collecting samples of recently diagnosed cases and working to do the sequencing that we need to do in order to verify if this variant exists in Nigeria or not. The other challenge that we're facing, apart from the challenge of the outbreak, is an increasing outbreak of misinformation. Every day we receive broadcast messages on WhatsApp, people sending forth messages that are unsubstantiated and in fact wrong. Not just wrong, they're unethical, some of them are simply unbelievable.
Let's now discuss this further with an expert. Public health physician Dr. Ayodele Oluwole joins me now on the program. He joins us via Skype. Dr. Oluwole, thank you very much for joining us on the program. Let me start by asking you, between the disregard for COVID protocols and this new variant now, what exactly might be responsible for these increased infections we're seeing in the country?
Oh, thank you, DEJI. There's so many factors. There's so many factors we can link up to this. If you recall that we've had some issues few months ago. We've had, first and foremost, we've had the protests. Remember, the protests were ongoing.
The NSAS protest.
It wasn't the NSAS protest. It wasn't as if the COVID-19 or the SARS-CoV-2 went to sleep at that time.
And there were a couple of elections too, local elections across.
Exactly. And then we saw campaigns, we saw electioneering and all the process and how people disregarded all the things that INEC had put in place. All of this can tell us that there could be an aftermath. And the aftermath, in conjunction with the fact that we had another lull in testing, okay? We had reduction in testing. We had gradual, almost grinding to a halt, people who come out to test. In fact, what we're finding at the hospital was that it was acutely ill persons who had come in with possibly respiratory distress and signs of COVID that were actually being tested, and those numbers were going up. So people were staying at home. People were going through all those symptoms and managing it in the coffers of their homes. And so we can find that community transmission was steadily going on. Community transmission was steadily going on at that time. And it's not totally unsurprising that we are having a gradual rise now towards this. And of course, you could see that we had a lot of entry into the country. We had entry into the country from the UK, from all over the world. People still traveled. I know a couple of persons who had traveled just at the nick of time before the second lockdown in the UK was announced. And people came into the country. And I was wondering, the Prime Minister was supposed to announce today, and you're in Nigeria already. This is coupled again. You know, I'm stringing all of this together.
Yes, yes.
This is coupled with the fact that we had a racket of fake results, you know, that were going on in the country. People were coming in the country, they were having fake results. I mean, you could see that there was a publication by a journalist, an undercover journalist, who showed how it traced from the airport to totally get a result. So those things were there. So all these things were going on. People were not self-isolating. People were gathering. Parties were happening in closed areas. And so it's totally not surprising that we are finding these high numbers at this time. Totally not surprising.
And also quite worrying that the new variant of COVID-19, the one from the UK, as the NCDC DG said there, might be in the country as well, and that could partly be responsible for these increased transmission we're seeing?
Of course, yes. Although there's no concrete research that has pointed out that these new variants might be severe, but more severe than the regular, you know, if I may say that, the regular SARS-CoV-2 that we have now. But something has been established. In the UK, in Canada, we found that there's about 40 to 70% transmissibility of the virus. So the risk of contracting these new variants is higher.
And what do you make of what the chair of the COVID-19 Presidential Task Force now said? I'm talking about Boss Mustafa, saying that in January, there's every likelihood now that we might see higher infection rates. Because the truth is that,
of course,
look, during this period, whether we like it or not, despite the protocols put in place, people are still violating them. Parties are still going on across the country, and people are still not using, they're just not complying with the protocols.
Yes, I mean, it is very evident that that we don't pray for that. But I mean, when we're looking at numbers and we're looking at events, we can comfortably say that we might be having large numbers in weeks to come, especially at this time where people are paying absolutely no regard to all the protocols and guidelines. There's been total disconnect between the governed and the authorities, actually, and that's in itself, it's one major factor. You will recall again the issue about the palliatives and how people's trust in government has been totally broken. So it's totally be a good place for government now to put in machinery of advocacy and continued engagement of the populace and the population to get them to fall in line again. Because we can do it. We can't afford what we went through during the first wave. We can't afford a lockdown right now. We can't afford to be shut down. Businesses have been run down. A lot of people have been out of jobs for a long time, and we are not looking to doing that again in 2021. Okay. So everybody must be, take responsibility at this time, and government also must be able to enforce and ensure that all these guidelines are followed.
Very quickly, let me ask you this. Look, we're expecting the vaccines to come. The government has said probably by the end of January, we might have the vaccines. And the target is to vaccinate around, say, 100 million Nigerians, maybe by the end of March. But that vaccine, we're pinning our hope on it. But even when the vaccines have actually not arrived, we're beginning to see a lot of misinformation about it. We're beginning to see a lot of fake news about it. How challenging do you think it will be, even when these vaccines arrive now, to administer them, for people to actually come forward to take them? Because you hear a lot of conspiracy theories around these vaccines.
Of course, absolutely. Again, we know that vaccine acceptability in the country has a long history. I mean, we have history, if you look at measles, at polio, and how long it took us to convince people, and how much work, you can imagine how much work and resources that were put into convincing people to take these vaccines and immunization over the years. So I'm not surprised that we are finding this. One thing that stands out, which I again emphasize, is the distrust between the government and the people, and it is in different sectors of our lives in the country. So how we need to convince our people and how we need to stem the tide of infodemics and misinformation, it really is in our hands, and it's a collective that everybody needs to put all hands on deck to stem all this.
And to be candid, public physicians like you would have a lot of work to do in that regard.
Yes, we have. I mean, I was discussing with a colleague yesterday, and I was almost frustrated that how much information that we've passed all year long. How much of it, we've done a lot. How much of it has gotten to government? How much has government taken advantage? Because in this kind of situation, this kind of pandemic, it's missed opportunities. If we don't do things at the right time, we will miss the opportunities of gaining traction in weeks to come. So if we don't do what we need to do right now, then in few weeks or months to come, we'll see the failure of what we'll be able to achieve right now. So we need to also continue to put out the messages right there in our local communities. Another thing, again, is to break down our information distribution and engagement. We must go to local governments and empower local governments also and local council areas to be in charge of those their nearest influence, the circle of influence. Get people. We've said this over and over and over. We need people of influence to pass messages. When we have negative information in this kind of pandemic, what can counter these informations is a superior, sensible, and true, correct information provided by people who the general population trust and believe. So we need to go and get people to push those informations, not just public health physicians alone, people of note. Unfortunately, that even persons who should know better are part of the people who are pushing this agenda.
Unfortunately, you're right. Unfortunately, that's just it.
Do not know. That's rather unfortunate. But I mean, we can't stop right now. We need to push information to the grassroots and convince persons that no, this is to our benefit, and also to ensure that people still follow the non-pharmaceutical interventions, because the vaccines we know that will not take effect just immediately after you take the shot, which is in 2 divided doses. So you still have a window. So you cannot take a first shot of the vaccine right now and go to town and say that I've gotten it, and then go back to our misbehavior all over again. So we need to continue to put into our daily life those non-pharmaceutical measures, okay, to avoid gatherings, large gatherings, to continue to cover our faces and noses, keep distances, and wash our hands. We need to continue all those. And if you look in the US, there's a campaign that's going on also that, yes, the vaccines are here, even for those who have had the vaccines. That we need to still, they also need to continue all those measures to fight this. And until we do that, still have a little more to do.
No doubt. Plenty of work ahead for us. Let's just watch and see how things pan out. But we hope the vaccines get here as quickly as possible. Dr. Ayodele Oluwole, thank you very much for joining us on the program and for sharing your thoughts with us.
Thank you very much for having me.
Thank you and Happy New Year.
Okay.
Well, that's how much we can take on the program. If you want to watch it again, it's simple. Just go to our website, tv360nigeria.com. You'll find this program and lots more there. You can also follow the conversation on our various social media platforms. I want to wish you the best in the new year. We'll see you next week. Bye-bye.